Professor, nice to meet you.
All right, audience, wait, group, what is your topic?
Mental health in the past.
Excellent, and thank you. Audience, are you ready? Group, are you ready? And proceed.
I'm sure everyone in our audience today has heard the term mental health before, and this is largely because the topic is much more acceptable to talk about. Having a mental illness isn't necessarily something that needs to be that ashamed of. However, it wasn't always this way. In this speech, my group and I will be teaching you guys about how horrific mental health and how people with mental illnesses were treated and seen as in early ages. To start out, I would like to define mental health. So the most basic and accepted definition given by Oxford University Press in 2022 states that mental health is a person's condition with regard to their psychological and emotional well-being. Like I said before, people that had mental illnesses in early ages were treated very poorly. University of Hawaii in 2022 wrote that it was believed that mental illnesses was caused by demonic possession, witchcraft, or an angry god. In this speech, my group and I are going to cover the initial perception of mental health and the unethical practices that were used.
To begin our speech, we'll like to talk about the initial perception. To begin, we have insanity. According to BC Medical Journal, BCJM 2017, use of early recorded history claim that mental illness was the product of supernatural forces and demonic possession. So essentially, in the early ages of medieval times, it was seen as unorthodox, and the people who suffered from mental illnesses kind of processed their thoughts differently than what society deemed as acceptable. And now moving to modern day, it kind of modernized into a more court law, and it was not always associated with mental illness. And now we use it more as a slang word.
Another huge factor that played into having such a terrible initial perception in early ages was the lack of scientific understanding people had in early ages. These ages were known as Puritanism or Dark Ages, where beliefs were very centered around religion and spirituality. And an event that really backs up my point here are the Salem witch trials that I'm sure you've heard of. This is a picture of a lady being accused of being a witch for such irrational ideas because beliefs and proof were so loosely used and centered around religion. And it wasn't until the era of rationalism and the Great Awakening in which beliefs shifted from being centered around religion and spirituality to be more scientific, backed up with fact and rational ideas.
Because we didn't really know what we were dealing with in the past and people didn't understand fully what the scientific variance of mental illness was, there were stigmas that were created. Mental illness was something that was undesirable to be associated with, and because of that, people would create false cause and effect scenarios. Since it can be debilitating without modern medicine, it was seen as punishment or even supernatural. Common supernatural theories attribute mental illness by possession by evil or demonic spirits, displeasure of God, eclipses, planetary gravitation, curses, and sin. Professor Ingrid Ferreras, 2022. Ferreras also stated that the Chinese medicine's concept from around 2700 BC attributed mental illness to an imbalance between positive and negative forces.
Well, this brought a lot about religion. During medieval ages, witchcraft and demonic possession played a big role in mental health. These people who suffered from mental health illnesses were kind of described as being possessed by demons or were witches, as we saw with the Salem witch trials. Most commonly, epilepsy and hysteria were more of those witchcraft and demonic possessions. Now, this began in Northern Europe and slowly progressed over into America, which we have Salem. And a lot of priests decided to get involved in this act, and they wanted to cure these people by using exorcisms. And one of the most common mental health illness that was used with exorcisms was paranoid schizophrenia. According to results from the Millen Clinical Max Axel Inventory 2011, it showed high levels of astonic personality disorder and narcissistic personality disorder in patients that underwent exorcisms as treatment. And next we have unethical practices of mental health in insane asylums.
So to start out with the unethical practices, I'd like to talk about insane asylums. Insane asylums really became popular in the mid-1700s, and they were the most inhumane mental health treatments. Talkspace website in 2017 called them notorious warehouses for the mentally ill. Insane asylums were allegedly used for treatment. However, they were more used as just a place to store these people with mental illnesses so that they could be out of the view from people in the community. Everyday Health website in 2017 said that the purpose of the earliest mental institutions was neither treatment nor cure, but rather the enforced segregation of inmates from society. Like I said before, treating these patients was not a huge regard for the people working in insane asylums. These asylums were used to just keep people isolated and restrained from society so that they wouldn't have to be seen because they were an embarrassment. In the book Shrinks, The Untold Story of Psychiatry, published in 2015, it states that the mentally ill were considered social deviants or moral misfits, suffering divine punishment for some inexcusable transgression. Oh yeah, sorry. So these are two tools that were commonly used in insane asylums along with many others. But like I said before, the main purpose of insane asylums were to restrain the patients. And so straitjackets and manacles were very commonly used just to restrain them. As you can see in the straitjacket, it looks almost impossible to move because it was impossible to move because they didn't want them acting up. This is a very heavy ball. It doesn't look that big, but they could weigh anywhere from 40 to 100 pounds. And they would just clamp this thing right onto the ankle of the patient so that they just couldn't move. And that would make the jobs of the people working in insane asylums much, much easier. This girl is Nellie Bly, and she went undercover in an insane asylum in New York in 1887. The insane asylum was called the Blackwell Insane Asylum. She wrote a book, 10 Days in a Madhouse, that was recently discovered and published in 2021. And right away in her book, she can recall that there was little to no examination for her to get into this insane asylum. And this proves that you could just be allegedly accused of being wacko or insane, and they would throw you in an insane asylum very quickly. She can recall the conditions in this insane asylum harsh, cruel, and inhumane. In her book, she writes, "For crying, the nurses beat me with a broom handle and jumped on me. Then they tied my hands and feet and then throwing a sheet over my head, twisted it tightly around my throat so I could not scream, and thus put me in a bathtub filled with cold water. They held me under until I gave up every hope and became senseless." What Nellie Bly is talking about in this excerpt is a practice that was very commonly used in insane asylums, where if patients were acting up, they would restrain them in a bunch of heavy white towels and just dunk them over and over again in cold water until they would just become senseless and stop reacting to the cold dunking of water. And in this picture, you can kind of see a man being sprayed with water. So if they didn't have the luxury of being placed in a bathtub, they would just get sprayed with the cold water instead.
Not only were the horrors of mental illness treatments in early times refined to the walls of insane asylums, but they were also out in the public, practiced by doctors. An example of this is the famous lobotomy. This was a procedure that was adapted from the Portuguese doctor Antonio Algaz Moniz's 1936 lobotomy. He would drill holes into the head and damage the frontal cortex in order to make them more normal. This inspired Dr. Walter Freeman, who saw the procedure as extremely innovative and something that they not needed to be brought to America. He wanted to streamline the procedure so that it could be practiced on the road without a surgeon and sterile environment. The process was simple yet so complicated at the same time. Freeman would insert an ice pick between the upper eyelid and eyeball of the patient and go parallel to the nose, and then drive the tool forward until it hit the orbital plate. He then hit the end of the pick with a mallet to break the bone 2 inches into the brain. He would then swing the pick in circular motions while still inserted into the brain, often breaking the orbital plate. He would perform these on both eyes within only minutes, states the Indiana Medical History Museum 2023. There are many risks and effects that came from this procedure that was either known or unknown. One of the known ones was that people would often suffer from black eyes. Because the orbital plates were broken, they would be left with eyes that were so black that they weren't able to see out of them for sometimes days to even weeks. Even the slightest slip or over-insertion of this ice pick could result in worsened symptoms. The symptoms that they tried to get treated would just get worse, and then they would backtrack on their progress. Worst case scenario, the patient would die. Because the brain is so important to all the body functions, a damaged brain could lead to death. And there was always a chance that patients could be left in an emotionless and vegetative state. The following quote from the JFK Library 2022 recalls one of the most famous examples of someone who was left in a vegetative state, the story of Rosemary Kennedy. After being persuaded that a lobotomy would help calm his daughter and prevent her sometimes violent mood swings, Joseph Kennedy authorized the operation. The relatively new procedure, which at the time seemed to hold great promise, left Rosemary permanently incapacitated and unable to care for herself. Rosemary was sent to St. Coletta's School for Exceptional Children, where she would live for the rest of her life. Another example of someone who suffered from lobotomy is Howard Dolly. In an NPR segment in 2005, Howard Dolly recalls his firsthand experience with the procedure. This procedure resulted from a hateful stepmother, and in her meeting with Dr. Freeman, she's reported stating that the reason for her concern is that he objects to going to bed, but then sleeps well. He has a good deal of daydreaming, but when asked about it, says, I don't know. He turns the room's lights on when there's broad sunlight outside. This was enough evidence for Dr. Walter Freeman to suggest a lobotomy to the 12-year-old boy's parents. This made him one of the youngest out of some 2,500 patients in the US to receive the procedure. He was lucky that he didn't die or experience the vegetative state that was often experienced by many patients, but he did experience mood disorders afterwards and is left with the shame of feeling like he is damaged from the procedure. So you'd think with something so invasive that Dr. Walter Freeman would provide evidence to his patients that was extremely in-depth and extensive. Well, this was not the case. His evidence was photographic and it was actually of people's facial expressions. He would put together a series of photographs of before and after the procedures. In the earliest pictures, before the people got lobotomies, he would have them look troubled, angry, and he would attach demeaning comments underneath that said that they just were not fit in society. After the procedure, he would have them look much more happier and proper looking, and he would attach positive comments, as you see here. According to Dr. Miriam Posner of UCLA in 2019, there's actually a solid foundation for Freeman's beliefs that photographs constituted acceptable medical evidence. He was drawing on centuries of psychiatric and philosophic tradition that saw the face as a legitimate and reliable indicator of the contents of the soul.
So what else happened in these insane asylums? He had many different unethical practices of torture and isolation, and one was insulin shock therapy. The method of insulin shock therapy was to give patients a heavy dosage of insulin, which would put them in a comatose state. This was a treatment that was used in many serious mental disorders, as well as in children for their kind of behavioral issues. It was used as a frontline treatment in about the 1930s and 1960s. In the pictures over there, you can see people administering the insulin through the nose, and they also did it through the needles as well. According to medical staff at the Bronx Veterans Administration writings about their treatment regime in 1960, insulin coma therapy was thought to relieve symptoms, including anxiety, tension, fear, irritability, hostility, elation, paranoid projections, obsessive and compulsive thinking, as well as delusions and hallucinations. But what did this kind of treatment have effect on its patients? So when a patient would wake up from their comatose state, they would have a sense of confidence and rebirth in their nurses, as well as they would gain a lot of weight. They would become grossly obese from laying on for hours in bed. Their brain would have permanent brain damage, and they had a very low death risk. According to an article published by the Journal of Royal Society of Medicine in 2020, insulin shock therapy had a 1% fatality rate, and patients risked permanent brain damage. Another case of unethical practice was bloodletting and purging. Claudius Galen, he was a Greek physician. He believed in mental health stemmed from an imbalance of humors within the body, which then kind of taught this English physician, Thomas Willis, who kind of switched his whole method and said that the internal biochemical relationships were blamed for mental health disorders. The method of bloodletting and purging was to tie a string around the arm and remove blood as in a way of cleansing for therapeutic reasons. According to an article by Everyday Health 2014, bleeding, purging, and even vomiting were thought to help correct those imbalances and help heal physical and mental illnesses in the patient. Another form of practice was solitary confinement. This was basically practiced in social and prison reformers in about the 1780s, and they had this belief that the silence of putting these mental health patients in a tight padded room would have them have this spiritual reflection and moral reflection on their actions and make them change the way their mental illness was. However, this had a lot of negative effects, which included depression, hallucinations, anxiety, and even the patients came out more agitated than they were when they were put in.
From the unethical treatments that were happening in early ages, there was a much impact on today's society. It's hard for us to believe the horrors that people experienced when they were being treated for an illness. Imagine if it was one of your loved ones and they were being treated for something that they couldn't control, but rather than getting help, they were abused, they were tested on, they were tortured, or they were condemned to solitary confinement. That is why it became a common ploy for horror fiction and psychological thrillers in today's era. An example of this is One Jumped Over the Cuckoo's Nest by Ken Casey. According to Independent.IU 2018, the book and later 1975 film adaptation told the story of a man who fakes his insanity, lessen punishment for his offenses. He's sent to a mental institution where he stands up to a corrupt caretaker, Nurse Ratchet, and after a power struggle between the two, he's subdued to electroshock therapy and is later left in a vegetative state by lobotomy. Use of mental illness as a substance for entertainment has done several things. It has brought awareness to the impact that it had in people's lives in a more realistic sense, as it portrays that it does affect people's lives and makes them struggle with things that ordinary folks wouldn't have to deal with. But unfortunately, it's also reinforced stigma around schizophrenia, bipolar disorder, and other similar illnesses, because it often villainizes them and makes it seem like they're crazy or not able to control themselves. However, this isn't the case. Altogether, it has brought media attention that is good and bad, as do most topics, but it has provided the narrative that help is available to those who really seek it out.
So as Jerson said, help is available, which I will get to later on in my extreme changes category. So with extreme changes, new medicines were brought to attention in the medical field as years passed and we had a mental health revolution. One of the medicines was fluoxetine, also known as Thorazine. It had many positive impacts as well. It got rid of the unethical practices that were in insane asylums, like insulin shock therapy, the lobotomy. And then it kind of led into a mental health revolution where we looked at mental health in a different way rather than looking at it as people were insane and evil and bad. We kind of looked at it as, yes, it is a problem. And that mental health revolution happened in the 1960s, which then brought about healthcare and insurance, making it more affordable for these people to get the help they need, not necessarily just putting them away and hiding them in asylums. According to the National Alliance on Mental Health poster 2020, 26.3 million adults have received mental health services. And over there are pictures of ads for the new medicines.
Looking back on how terrible mental health is viewed and how horrible people that suffered mental illnesses were treated really provides a sense of appreciation for modern mental health treatments. It's so eye-opening to see the way discrimination and lack of understanding unnecessarily hurt people by people. Because of the expansion of knowledge surrounding mental health, the initial perception of it has improved immensely. And because of advances in science and medical regulations, unethical practices are much less heard of. It's safe to say that the viewpoints surrounding mental health are much more positive than they used to be. A survey done by the Harris Poll on behalf of the American Psychological Association in 2019 shows that 87% of American adults agree that having a mental illness or a mental disorder is nothing to even be ashamed of, and 86% of American adults believe people with mental disorders can get better. This is a little drawing that I did that I feel like respectfully represents the evolution of mental health. Here on the left side of the screen, you can see a bunch of darkness, which is supposed to represent how mental health is viewed and how people were treated in early ages. And over here, this lighter side of the screen is supposed to be the ideal, unrealistic world where people that suffer mental illnesses aren't judged and get the respectful treatment that they deserve. This is where my group and I believe that we are today. Obviously, we've come a very long ways and we are in the light, but there's always room to go. But the future is very bright. Thank you.
Yeah.
I felt my lungs just collapse on me mid-speech.
Thanks for coming.
This is great. I'll also make sure additions to come back to the rest of it.
You just at the neighbors, sir? You just at the neighbors? Are you in her class now?
No.
Well, who's your teacher right now? That's what I'm asking. Okay, tell him he can email me if there's an issue with you showing up there.
I don't know, guys. My lungs just gone.
Where'd it go?
I don't know. My chest got tight through that, like the second part of the speech, and I just felt like